Okay. So the superficial muscles, you can see these big muscles. Those are called the erector spinae group. And they run basically from, the lumbosacral region, this lumbosacral aponeurosis, all the way up to the neck. And so they'll stop at different points along the way sometimes. But as a group, they're the extensors, and they run from bottom to top. Okay? And then we can look at some of the deeper muscles. And so the spine is surrounded by lots of muscles and ligaments, which give it a lot of strength. So these are your big muscles, okay, for your posture. These are little muscles that manage every little segment all the way along the way. So can you see how that would give you a little extra added strength in there? Okay. So the muscles, so if you look at how the nerves work, the muscles of the neck and the trunk do not receive innervation from branches or terminal nerves of a plexus. So in other words, neck and trunk are not part of the brachial plexus. They have their own nerves. Okay? The muscles in the neck and trunk have groups that span several vertebral levels. Okay, so they receive their innervation from the spinal nerves at those various levels. Okay, so we talked about spinal nerves before. Okay, so they get their innervation from whatever level they serve. Okay. And this is just a reminder of your spinal cord and the nerve structure. So obviously here's your cord, cauda equina, peripheral nerve, so this would be your brachial plexus, this would be your lumbosacral plexus. And then these are those little nerve roots all the way along the way. Brainstem. Okay, so let's talk about exercise principles a little bit with the primary trunk function. Basically, we want to always work our core for ourselves, but also for our patients, because it's our stabilization against the effects of gravity. We want to create a stable base so that the muscles of the extremities can function more efficiently. So basically, you've got to have a stable core in order to make this and this work properly. It's like over time, it's kind of, any more people just expect to have rotator cuff problems as they get older? I think a big part of that is because we're not